I'm Elaine Sanchez, BAMC's Public Affairs Officer. Good afternoon, and welcome to the San Antonio Market's MHS Genesis Town Hall. Today, we are privileged to have a panel of experts to answer your questions about the military health system's new electronic health record. MHS Genesis will be implemented January 22nd, 2022, and we want to make sure everyone has the information that they need. During the town hall, we will take questions from our Facebook viewers while also sharing pre-submitted questions. Thank you to everyone who took the time to submit prior. We'll do our best to share as many as we can over the next hour. At this time, I'd like to introduce our distinguished panel. Please welcome Colonel Patrick Osborne, the San Antonio Market Surgeon-in-Chief and Chair for the BAMC Informatics Steering Committee, Lieutenant Colonel Dorian Walton. He is our Genesis Site POC, Major Melissa Everidge, Women's Health Nurse Practitioner and former Genesis user, and Tim McCann, the 59th Medical Wing's Patient Portal Champion. Welcome to all of you and thank you for being here.
Thanks, Elaine.
We are going to move right into the question and answer portion because we're excited to see what questions we have. We're monitoring Facebook, so everybody who's out there watching, welcome. Please post your questions in the comment section. We're monitoring, and we'd love to ask your questions. And I'm going to now turn over to Jason to see if there's any questions so far. All right, so while we wait for some questions from our Facebook viewers, we're going to ask a few pre-submitted questions. To start, can you please provide an overview of Genesis and why it's being implemented?
Dorian? Yes, sir. Sure. So there, as everybody knows that has used the system as a healthcare worker, we have two different healthcare or emergency electronic medical record systems, and we don't share with the VA. They don't cross-talk very well with the VA. And obviously, we move on to the VA after our time in DoD in many cases, and so that was the initial congressional pushes to have better interoperability. Certainly, our legacy systems that we're currently using are getting older by the day, and certainly this is a modernization effort to really push us into the 21st century and get a modern EHR where everything outpatient and inpatient is together, where it communicates better with outside facilities and entities.
Thank you so much. Anybody have anything to add to that? I'm sure we'll get to a lot of it during the town hall.
Yes, we will.
How will this implementation of MHS Genesis in January impact patient care?
Any change of this size is going to have some hurdles to cross and is going to take time. So everybody should expect delays, unfortunately. I think the best advice that we can share is if you have something that you know needs to be taken care of for your health or for refills or whatever it might be, to schedule that as soon as possible. If possible, schedule it before go live on January 22nd. Get your refills ordered and take care of these things beforehand as best you can. And certainly what we also want to do is maintain that extra time that we've built into the clinic, so our access will go down initially, and we want to be able to take care of any acute issues. So if you can't get a primary care visit, there are other options. There's the nurse advice line and other ways that we can provide health care without flooding the emergency center at Wilford Hall or the emergency department at BAMC, and where we can still provide that care without really inundating and making the system reach a critical mass. So prepare as best you can, look at your refills, get those in as soon as possible. If you have visits that you need to get done, please get those done ahead of time. When we get through this, and it will take some time, I don't know how much, it will be better. Things will communicate better. I think things will be more efficient. But part of this is to improve safety for patients, but that will take time. But when we get there, I think this will be a huge leap forward for the military health system.
And just one thing I'd like to add to that, sir, is one of the best things you can do to prepare too is just be informed. I know Elaine, you're doing a lot of messaging out there on Facebook Live and other mediums for BAMSI. So if there are questions out there, please submit those. We have a team of people that will provide answers for you and can hopefully alleviate some of your concerns ahead of time. So be informed as much as you can, ask questions when you can, and we'll get you the answers.
Thank you so much, both of you. We do have a few Facebook questions, so we'll move over to that, and then we'll go back to our pre-submitted. Alice Barsumian asked, is there anything we can do as patients to our online profile, which will make it easier to implement the inpatient electronic health record, such as verification of information or completing a profile?
I know when I signed on to Tricare Online the other day, I got a pop-up to list my medications or to confirm the medications that I was taking at the time. And my assumption was that carries over, that will cut over to Genesis as something of my lifetime pharmacy kind of history. And Tim, I don't know if you know anything on that with the Tricare Online portal, if there are things that people can knock out beforehand, but that's what I assumed that was for me.
Right, so your demographics carry over from DEERS, so the same as it does for the Tricare Online patient portal. So the first thing to do is just go and sign on to the portal, and then you can verify your demographics are correct. And the rest of it will populate as we go live for Genesis.
And I think an important thing to mention is, correct me if I'm wrong, or saying that's going to happen automatically. So there's nothing the user needs to do specifically. Their profile should be imported over to the new Genesis portal.
That's right. You're not establishing a new logon. So the logon is the same as it is for Tricare Online. I believe we'll have the link on Facebook. You can go to the link and just sign on for the first time. Once you're in, you're established. So.
But maybe that's something we can get a good answer on, because if that is something where it can help with the lifetime pharmacy history to get people logged on to Tricare Online, that will help a lot with potential pharmacy delays going forward.
And I also do know that the Genesis portal will support DS login as well as CAC.
Yes,
so that's important for your beneficiaries.
That's correct. You can use your MyPay, you can use your Common Access card, or your DS logon.
Thank you so much. We do have a couple other questions, but just so everybody knows, in a few minutes we'll be posting the link to the new patient portal for the MHS Genesis patient portal. And just to be clear for everybody, Tricare Online is going away and Genesis is taking over. Can you clarify that a little bit?
So Tricare Online's not going away. The functionality on Tricare Online is tied directly to the MTF. So some of the functionality will change. So you won't be able to message your team. You won't be able to schedule appointments, but you will be able to see your history. You'll be able to see your records. And so it'll still be available to the patient. So should you PCS to a base that doesn't have Tricare Online, hasn't transitioned to MHS Genesis, once you establish your relationship with your new primary care team, you'll go back to using Tricare Online. So it's not going away, just some of the functionality here in San Antonio.
And the best advice right now is for people to use their DS logon or their DFAST or their CAC and try to log on to the system and just kind of get used to it.
Absolutely.
Mm-hmm. Wonderful, thank you. A question from Tammy Spencer. Will this program have our medical history from previous procedures and medications, or will it only pick up going forward from its inception?
Yeah, sure. Yeah, so there's a system we have called the Joint Legacy Viewer, which will still have all of your historical information from before Genesis. So if the goal is to ultimately migrate that JLV to match up with your profile to Genesis, but in the interim, providers will still have access to a read-only access to look over your past medical history moving forward. Does that sound about correct? Right?
Yes. Mm-hmm.
But again, medications, your medication history, and certainly your current medications, that does need to be something that is updated.
Yes.
And that's certainly something that has been identified as causing delays for people that go to the pharmacy. We have things in place to provide extra support to knock that out when somebody does go to the pharmacy for a new prescription for the first time. But again, we'll get the answer because if you can go in Tricare Online now and do that, I think that would streamline things for a lot of people.
And it kind of goes back to like the first question that talked about how can the patients prepare. And one big aspect to Genesis is patience. Patience with the whole process, because everyone is going live at the same time. Pharmacy is going live, lab is going live. And just to piggyback on what you said about the medications, when patients come in for the first time, they're going to be asked all the medications. And it takes time, and as well as all other questions related to, your intake. And so just patience. Patience is key.
Thank you. That's a great point. And patience throughout, because there's going to be perhaps a little more delays across the board, like you mentioned, sir, with services and with care. So that's the big message we want our patients to understand, and hopefully be patient, and let us know if there's any issues. Send us a message on Facebook, send us a message on Twitter, however you want to do it. We will be listening and watching. So another question on Tricare Online. We may have sort of answered it. From Tom Davis, will my Tricare Online health records cross over to the new patient portal, or will I need to maintain access to Tricare Online for past treatment?
So as you use the system, some of your information will cross over, but I would recommend keeping that Tricare Online access so you have record of those documents that are in Alta.
Thank you. So I'm going to go back to the pre-submitted questions for a minute. I think we answered several of them, so I'm going to skip over to a question for, let's see. Oh, do patients need to have training to access or use Genesis? If so, where do we get the training? Other than updating our profile in Tricare Online, is there something specific we need to do to get access to Genesis?
So there's no training for Genesis for patients. Once you log on, again, the first thing is get on there and start navigating around. You'll find it very easy to navigate if you're using Tricare Online today. There are some questions and answers. There's a document at the bottom of the sign-on screen, the landing page, with some questions and answers. I jump onto that and read those questions. And then there's a 1-800 number also listed on the bottom of the landing page. If there's other questions or you're having trouble navigating, that's available to you.
And so I'd just like to clarify something, because MHS Genesis itself as the electronic health record is separate than the MHS Genesis patient portal. So those are two different things. So like, I think that question was asking something about training for like Genesis electronic health record. That's all for providers and clinicians and everything. And the portal is what feeds into that, and that's how the patients get their lab prescription information and stuff like that. So for the portal port, like you're saying, so there's no training required, but for the actual electronic health record, that's a separate thing for the facility.
Is there a mobile app, Tim, or a plan for one?
Not that I know of. So the site itself it will adjust to whatever device you're using, your phone or your tablet or a desktop computer. But as far as I know, there's not a plan for a mobile app at this time.
Okay, we got another question on Facebook from Michael. What are the negative aspects of MHS Genesis that will complicate patients' user access, availability to our health records, prescriptions? So it sounds like he's asking, is there a potential for patients having trouble accessing their records?
Tim, you can back me up on this, but I think logging in, just like you log into Tricare Online right now, I think you will be able to log into the MHS Genesis patient portal and be able to see those things. Now, again, we talked about medications need to be updated, and so you will need to monitor and make sure that your Tricare records do cross over. That is part of the process, as Major Average mentioned was, at that first visit, we will continually be updating things and making sure that all those holes are filled that are in the new record. You should be able to, and certainly your physician or other provider who is managing your prescriptions will be able to look into that joint legacy viewer to look and see what you have. And be able to put that in. And so access may take an extra step at first until everything is updated, but it will be there. But I think at first patients will probably have to make sure they maintain access to both until that migration is complete. And again, I'm hoping that pop-up I saw on Tricare Online is something that will actually cut over to Genesis. That would be a huge help.
Thank you. We got another question about the Tricare Online patient portal, and I'm really glad people are asking these questions, especially some of our Facebook viewers may be tuning in a little later. So it's great to reiterate these points because they're super important. So Miss George asked, if we currently have a Tricare Online patient portal, do we need to create a separate account for MHS Genesis patient portal?
So you're only establishing access to the new patient portal, but otherwise the access is exactly the same. So you're just establishing access. You're not creating something new.
So what you log in with now to Tricare Online, if you go and put in that username and password, you will be able to log into MHS Genesis.
Absolutely.
Thank you very much. Richard asks, how long may we expect to be deferred to Tricare network providers?
That's a great question. And I'll be honest, I don't know. I think it'll depend on the kind of care that you need. I think for primary care, and maybe for women's health primary care, and you can certainly opine on this, I think this is a huge leap forward on efficiency for that sort of patient encounter. So we hope that within maybe a couple weeks, it may be a month where some of this that access is decreased. We are certainly leaning forward as much as possible to going back to quote unquote normal as quickly after go live as we can. Specialty care will be a little more detailed and depending on the specialty care that you require. Certainly, if you are deferred out, our doors are open for you to come back, and we certainly would like you to come back and get back, with our clinics and our healthcare team, so we can pick up where we left off if that is the case. But we will continue to communicate, as Lieutenant Colonel Walton said, this is all about communication and information. So, things opening up again or things that might be a little bit delayed in reestablishing access, we'll communicate those as best we can as we know them. And maybe you can speak a little bit to how quickly in your previous experience things did open back up.
So it kind of goes back to, during this time, the decrement is established so that issues can be figured out. So we just got to be mindful of that so that, the issues that arise from pharmacy or lab, those can be ironed out. That's why there's a decrease in the care. But as soon as those are ironed out, we increase. It didn't take long for us to increase, but you do want things to be right. You want your T's crossed and your I's dotted, and to provide the quality of care that we all desire to have and to give. So it wasn't that long. It wasn't, maybe a month or so, but it was each week we would go up more and we'd see how we were doing, and then we'd go up more or just iron. So it was just a week by week.
And I think every go live at the previous market or MTF, military hospital, things have gotten better, new lessons have been learned. I will say from my standpoint, and Colonel Mayo and my counterpart over at the 59th, I think this team is prepared exceptionally well to the best that we can. But I think you keep on hearing a couple of things, lab and pharmacy. Lab, I don't have a great answer for on other options. Lab is going to be slowed down until we figure some things out. And if you need labs, I would be prepared to endure some of those waits. Pharmacy, I think there are some good options. And I would ask patients, again, update your history, but also things like Express Scripts. One of the nice things about Genesis, and I asked this today, I don't have to do anything new to be able to prescribe to your local pharmacy that's around the corner. And so ask your healthcare provider to do that for you if you do see them, to get your prescription at whatever that closest pharmacy may be. And that will help with efficiency as well, and not cause a backload at an MTF pharmacy. That may come with a copay. So be prepared for that. But in some cases, I think your time might be worth that copay. And it's certainly an option, and it's definitely a convenient option that patients should remind their physicians and other providers about when they see them.
And just to hop on what Colonel Osborne is saying too, I know the pharmacy is doing a really good job of advertising some of these changes that are happening right now. So as you go to refill those prescriptions prior to go live, just look out for those pamphlets and that information. Like I'm going to harp on that communication piece again. Also, as we move forward past the go live in 22 January, we're also working on a communication statement plan to make sure to let the market know, when we start to increase and when we can want to start people to come back and we're good to go with the system. So it's a twofold thing. Just we're trying to push out the information now so you guys are aware and know what's coming, and then also please look out for the information after go live as well.
Thank you so much. And the information, just so everybody's aware, will be posted on our social media sites, which everybody's on right now who's watching, along with the BAMC internet and other venues such as secure messaging. But just keep an eye on all those different marketing channels. Thank you very much for the responses. That was great. We did post the Express Scripts home delivery link in the comments section. And those are for 90-day supply, I believe, of your pharmacy prescriptions. So we have another question on Facebook, and I really appreciate all the engagement. This is great. From Cindy, if for some reason something doesn't appear down the road, will we have someone to contact? I know my prescriptions have moved.
Yeah, I'm not sure either. Again, the old electronic health record will be something that we can still access to find records. The ability, if a prescription moved to a different, say from BAMC to Randolph or to another military pharmacy, that those records should be still available. Again, when at that first visit, you will have to update those medications, and the team in the clinic that day will be working and taking the time to do that. But all that information should be available, whether it's cut over to Genesis when we go live or in that joint legacy viewer that Lieutenant Colonel Walton mentioned.
And your complete prescription history is still available on Tricare Online. So you can always go on there and print it out if you needed to, bring it with you to your visits.
Thank you. Next question from Richard. How will my PCMs, primary care managers, schedule be limited during implementation?
So initially, we decreased access or the number of appointments that we're offering by about 50%. We are trying to supplement that with virtual health, the nurse advice line, and other venues to do that. Again, as much as possible, we want to make sure that the Family Emergency Center at Wilford Hall, the emergency department here at BAMC, are for those purposes and not primary care overflow. And the teams in those areas have been working very hard together with both the emergency medicine staff as well as all the other departments in the hospitals and at Wilford Hall to really have a good plan to shuttle patients as best we can. But again, trying to keep that burden on the emergency department for emergency type patients is a key thing. Again, as quickly as possible, as we work out some of the issues and as patients have a history already put in, things will get faster. Really, we hope to be back to at least 75% by 30 days post go live, if not sooner, and then out to 100% by 2 months. Again, that is kind of a loose timeline of what has been published as kind of guidelines, but we're going to try to ramp up as much as possible. We have 250,000 beneficiaries in this area that we want to take care of. And everybody that gets deferred out, we are at risk of not being able to provide care to those people. And that's important to us for many, many, many reasons. And we provide excellent care, and we want to be able to continue to do that. And so I assure everybody that as quickly as we can do this safely, to move things forward, to do it efficiently, to provide the standard of care that we are used to and that our patients are used to, we will open things back up.
And just to add on to that as well, and for everyone's edification, to be transparent, that decrement starts in the new year. So come January 3rd, so that's prior to go live, that decrement starts. And the reason for that is that we have several activities that are designed to help all of our clinicians and providers be better familiarized with the system and do some additional training on the system. So that way, the more we know, the better prepared we are for go live, the quicker we can get back to take care, doing patient care full time. So all those activities that are going to be going on in January is all to make sure that we aren't decremented for longer than we need to be.
Excellent point. Since, sir, you were talking about the emergency department, do you want to provide a little reminder about urgent cares as well?
Yeah, so I'm not sure the exact policy that DHA or Tricare has put out, but that certainly is an avenue for people to utilize. I know people are already utilizing it, but that is an excellent resource, and obviously they're, in many cases, are much more convenient than driving across town or from an outlying community. And so those resources are available to people as well. And all I would ask is that you make sure that you keep those records that you do have from there, so we can make sure that we have a handle on what care you were provided.
Thank you so much. And just as a reminder, beneficiaries, just make sure it's a Tricare authorized urgent care center when you go. So another question from Facebook from Richard. Thank you again, Richard. Will elective surgeries be delayed, and how will you communicate this message to us?
So just like Lieutenant Colonel Walton was saying, access is decreased. For clinics that we are also decreasing the number of operating rooms that we'll be running during that time. We are not going to stop doing elective procedures. There may be delays, and your surgical team should be communicating that to you right now. And the surgery date that you may be assigned right now is likely a result of that decreased OR capacity. So we don't plan on stopping. It might be a little bit of a slowdown, but we will get back to you. And again, if you are deferred out during this time frame, our doors are open. We very much would like to have you come back and for us to provide that surgical care and other specialty care and primary care for you.
Thank you, sir. Actually, I'm going to just ask that real quick. From Kay, with this new system, will you be able to send messages to your primary care manager as you can with Tricare Online?
I think you should for
Tim,
MHS
yeah.
Genesis portal.
Yeah.
Yes, absolutely. Through the patient portal, you can message your care team, and also the provider, the clinicians can message patients. And the benefit is it's all in one system, right? It's all combined. So as you message your provider, if it's something that needs to go in your medical record, it's included in your medical record. So yes, absolutely, you can message your care team through the patient portal.
Thank you. Another question, another great question on Facebook from Dan. As a veteran with a primary care manager at the VA, does my medical data migrate over to Genius?
I
guess I meant Genesis. Didn't know if there was another
Yeah.
platform.
Entirely possible.
It's very possible. For example, if I use your ER.
So again, the Joint Legacy Viewer that Lieutenant Colonel Walton mentioned, that those records will go into their VA medical staff can pull from that JLV and see that, and likewise, we can pull from the VA system. Eventually, when the VA has completed their rollout, when Audie Murphy and all those clinics complete their rollout of their version of Genesis, there will be very seamless communication between the two. And again, that was the number one reason why this change was mandated by Congress several years ago.
And just to kind of caveat to that, the whole reason for this is, X amount of years from now, when a soldier member, or any military member, be it, Air Force, Navy, Coast Guard, Marines, it's all going to be one centralized record system through your active duty service all the way through the VA. So it's going to be one seamless system instead of having it siloed by service department or after you get out the military and retire. So that's the long-term kind of goal to it for all those young soldiers out there and young beneficiaries.
Thank you. This is from Cynthia. She's asking if there's a phone number to call if I have issues with Genesis. I'm guessing she means the patient portal. So she's wondering if there's a phone number she can call if she has issues.
There is. I didn't bring it with me. We can find it and post it on the Facebook. But when you log in, again, go the first time, go and log in. Right at the bottom of the landing page, there's a 1-800 number there to assist you.
Wonderful. And the Facebook questions keep coming, which is great. So thank you again to all our viewers for your engagement. Coming from Ruth, what about privacy? Is it true that signing on will give the government access to all my data on all of my devices, as was in the statement for Tricare Online?
I have no idea. I would have to look at what disclaimer that might be on the MHS Genesis landing page, but I have no clue.
Thank you. And we'll get back to Ruth on that. Another one from Richard. Great to hear from you again, Richard. Will access to primary care be limited during implementation? If so, will I be instructed to go elsewhere for the care, like an urgent care center?
Yeah, so again, as Lieutenant Colonel Walton reminded me, we are drawing down our clinic access, primary and specialty care in the new year to prepare, and then obviously for go live and then into the post go live area after 22 January. Urgent care is an option. The nurse advice line is an option. The online portal to communicate directly with your healthcare team is an option. And again, it's not like there's going to be no appointments, but there is going to be significant decrement at first. But we'll work to get back to 100% and get you back in as soon as possible.
Excellent, thank you. From Allison, if we're referred out to the network, will we be able to continue to see that provider indefinitely, or will we be moved back to base providers at some point?
My understanding is that for primary care, it might be a temporary deferral out, and then we will look to bring you back into the system. For specialty care, I don't know for sure, but my guess is that if you're engaged, certainly if you went out and got surgery from somebody because you needed some sort of procedure at that point, continuing that follow-up for the appropriate time frame is certainly something that I would anticipate patients would be able to do. But we're not looking to disengage people who are deferred out forever by any means.
Thank you. And I want to say thank you to our 59th Public Affairs counterparts for posting some of that information that was just requested, such as the phone number to call. So that's already posted here. Richard asks, what messaging will be developed for MTF Prime retired and their family members who will experience copays for any care delivered in the Tricare network that's normally delivered in the military treatment facility during implementation?
You might be best to answer that one, Elaine, for the messaging piece. I'm not sure what we have pushed out there at this point, but I think that's an excellent point of being very transparent of what the Express Scripts, what the local pharmacy and other copay policies and what the standard is at this point.
Yes, we'll definitely be posting information about those copays, as well as we have the new 2022 pharmacy copays that we're going to push out shortly in an article and on Facebook.
So Tricare publishes those. They're available online, and we can find that link also and post it out there. All the copays are published out.
Excellent. We'll be posting the link to all the copays, either BAMC or 59th. Coming from Wendy, since Genesis goes live on a weekend when the clinics are closed and the ORs are down for scheduled cases, has there been a talk about capping beds for the inpatient wards, especially given the high census for the last couple of months?
So this is a frequently asked question and certainly something that we are paying a lot of attention to and planning for. The shorter answer is no. We are doing what we can to certainly curtail surgeries that elective surgeries or non-urgent surgeries that would result in an admission during that pre-go live and then in the immediate period after the 22nd. And that is one way that we can control the census. We have 250,000 beneficiaries in this area, and people get sick, and we have to provide that care. And the other piece of it is that, as everybody knows, is that we are one of the 2 level 1 trauma centers in this 22,000 square mile area. And this community relies on us, and that is our beneficiaries included, to provide that emergency care. And so we're instrumental in really maintaining the regional trauma and emergency management system, whether it's burn, whether it's trauma care, illness, things like hyperbarics. If somebody, we have people that come in and have a diving accident, we put them in the hyperbaric chamber. There's all these things that we provide to this community that includes our beneficiaries that we can't reliably cap our census. And certainly the entire healthcare system remains very stressed from staffing levels. The number of beds that can be offered in the hospitals in this area is not essentially unlimited like it seemed like it was in the past.
Thank you so much, sir. Coming from Shannon, can active duty go to an urgent care center near them if they need to be seen?
Again, ideally, you find a Tricare approved urgent care center. And it seems like most urgent care centers typically are, but I would check online. I believe it's listed online, the approved urgent care centers. But yes, that is certainly an avenue to continue to get care when you need it, if it's not emergent and if it's not something that can wait for primary care availability.
And we can clarify whether a referral is needed. I believe a referral is needed for active duty, whereas a family member beneficiary does not.
Yeah, we just need to confirm, and Matt, maybe if during this time, if that referral is still needed or not. That's something we can post.
Okay, so we got the nodding confirmation, yes. Active duty at this time does need a referral to go to urgent care. Family members, other beneficiaries do not. So just make sure it's a Tricare authorized to avoid exorbitant costs. Moving back to our Facebook questions, Cindy asks, should I try and make follow-up appointments with services such as neurology, surgery for February now, since these changes are in January?
I think making those plans ahead of time as best you can would be ideal. That February appointment may be March, I don't know. But I think getting that appointment set now certainly helps, and it doesn't get somebody caught up in the mix of the actual go live event where things might be a little more hectic. So if you know you need a follow-up, if you know you need a prescription, if you know you need labs coming up, if you can either get them done before go live or time things so you can push them till later when things are back to more normal, I think that is always a good recommendation. Obviously, we don't want to delay care that you absolutely have to have, but if you have a follow-up scheduled and it can be pushed to a later date to accommodate things, we'll certainly work to accommodate you.
Thank you, sir. We really appreciate all the Facebook engagement. It's been incredible. We had a brief lull, so I want to turn back to the pre-submitted questions because I know a lot of staff members submitted questions ahead of time. This question is, what exactly happens at midnight on January 22nd? Will orders, notes, labs, imaging, etc., be transferred over from Centris to Genesis?
Yeah, sure. So we actually go live at 06 in the morning, come that Saturday, but part of our cutover team that we have here at BAMSI is actually working on those very things, is transcribing all those orders and labs over from the, that are current, over from the legacy system, Ulta, into Genesis right now. So we have two POCs, well, Major Rich, Major Wyatt, no harm putting their name out there, who are working on that very aspect for the hospital.
And some of that activity is going on right now where some areas are able to start front loading some of that patient care. OB is one of those areas. And then as we get closer, other areas will also get that similar access. So, you know, the clinic schedules can cut over, surgery schedules can get built in. A lot of the team will be in on that weekend to make sure that things are ready to go as much as possible, records built, orders put in, et cetera, for Monday morning for clinics, procedures, surgeries, et cetera. And there's a huge amount of work that goes into all the inpatients that we have here, you know, 250 plus, that on the night of the 21st or morning of the 22nd, where all that stuff has to be cut over. So we have a good plan in place to do that, but it's going to be a massive amount of work, and a lot of planning has gone into doing that safely.
Thank you so much. Another pre-submitted question, can we get Mock Live opened earlier? I really want familiarity with navigation and would like the extra time.
I can take this one, sir. So yeah, with the mock go live schedule, we just talked about this today in our informatics steering committee meeting. We're trying to get all the departments to contact my planner, Captain Ligby, and Ed Harris, to get those times and blocks scheduled in and filled in for the pre-go live activities section. Now, if there aren't scheduled mock go live sessions that you as a provider or clinician would want to participate in, please let myself know and let my staff know. You can send me an email directly, and we can work with our Leidos partners, our contractors, to create some of those sessions, and possibly, if not mock go live, at least do a peer-to-peer or a, what was the other one called? I'm blanking. Well, there's several avenues that we can do to get you extra training on the areas that you feel uncomfortable with for your particular area or department.
So Mock Go Live is certainly a set event, and there are specific scenarios that different areas are going to go through. And then there's something called Learning Lab. And again, if you haven't heard these terms, the people that work in Wilford Hall, all the outlying clinics, and certainly at BAMSI, you need to be asking your super users, your supervisor, your chairman, your chief, when are these events for us? And really force yourself into the conversation of getting signed up for those things. And again, I think you guys, Matt, have done more work on this, getting into the training environment for a wider audience, so people can click buttons and navigate around. Now, some of the issues with that is it going to be exactly what we see starting at 6 o'clock in the morning on the 22nd of January? We don't think that it's exactly the same. Still, every bit of familiarity can help. But again, there are set events. We're working on some specific areas to get earlier access, to work through specific workflows and really work through some of the kinks. So some of the more complex things that we do, we have some greater familiarity for the people that will be certainly working on the inpatient side over the weekend. I think clinics, by and large, are going to go. They'll be slowed down, but I think they'll go well. The thing that we're placing a lot of focus on are those call teams and those people that are scheduled to provide care at at the FEC or wherever over the weekend. We're looking at every avenue we can to get people familiarized. But again, if you haven't heard the term Mock Go Live, if you haven't been signed up for that or Learning Lab, you need to ask and get plugged in. And then the other thing is, there's a lot of support that we will look forward to seeing. I think, what do they come in the week before?
Yeah, well, a couple of days before.
Yeah, so a couple days before, we really hope to see a significant number of people, contractors that they call at the elbow support, that'll be in certain areas to help really kind of help navigate people through the system. We have had initial training for our peer experts, our super users here. I know lots of super users are very concerned about not feeling super, to quote a phrase, but their training is not done. And certainly the Mock Go Live and the Learning Lab is for them as well, but they will be deployed in the appropriate areas of clinics and inpatient wards, et cetera, to make sure people know. And then there is the Pay It Forward group, where previous site personnel actually come here on temporary duty and are plugged into the hospital to help navigate and continue to teach and really work through those issues, so we can be as efficient as possible. So there's a whole structure that we really hit in January of getting additional help, additional familiarity. And I get it, we're not going to get rid of all the anxiety. It's not going to happen. But we want to minimize that. And I would implore everybody to keep your wits about you. It is going to be new. It is going to be unfamiliar. It is going to be stressful. It's stressful right now. But we will have help on hand. And a lot of this works. A lot of it we're going to have to figure out. But I think by and large, for providing safe care, if people can take a breath, they'll be able to do what they need to do in most cases. But that does mean that everybody's going to have to take all those opportunities that they can to learn and reduce their anxiety level beforehand.
Thank you so much. Great advice. And I'd like to ask Major Everidge, as a former, having been through this, do you have any insights or thoughts or advice for us here at BAMC and at the 59th?
So it's interesting because I remember that anxiety when we were going live at my last space. It gets better when you go live, and that's the anticipation of the unknown. And so getting access early really isn't going to help you, because I thought I'm the same. I want to get in, I want to practice, I want to play around with it. It's when those patients come that's when you'll start navigating, like, what you know, what you don't know, and who, using the Pay It Forward team and the super users to help you in that area. So getting access isn't going to help you if you don't have any patients. If you don't have, you submit something to the pharmacy or to the lab. And I keep bringing those up because we're all one team going live together. And so it's going to be chaotic on all ends. But we all get through it because lessons are learned very quickly when the patients come. So.
Thank you, ma'am. Appreciate it. Next question, does Genesis offer electronic prescription capabilities with Express Scripts?
Yeah, as we mentioned before, certainly that capability is there. The ability to prescribe it, your neighborhood pharmacy is there. We talked about putting out the copays that go with that, but certainly it is a very convenient avenue. And I would ask patients to remind their healthcare team of that option if they would like to get that at their local pharmacy to really prompt their team to do that. And again, that will really help with the pharmacy slowdown that every site has anticipated just because of learning the new system.
Thank you, sir. Ernest on Facebook asked if we could list the panel members' names again. It's probably to put a name with what your wonderful words are. So we have Colonel Patrick Osborne, who's our Market Surgeon in Chief and the Informatics Steering Committee Chair. Lieutenant Colonel Dorian Walton, our Genesis Site POC for BAMC. Major Melissa Everidge, Women's Health Nurse Practitioner and former Genesis user. And Tim McCann, 59th Medical Wing Patient Portal Champion. Moving on, I'm going to skip a couple of these questions. We addressed them prior, but here's a great one. When will Genesis have the functionality to interface with other healthcare organizations that are not a military treatment facility or the VA that share mutual patients, such as Methodist, Baptist, UT Health, et cetera?
Jim, I don't know if you know.
HIE, right?
Yeah.
Everybody- So from what my understanding, and please, John, if I'm incorrect, but all the medical facilities that participate in the Health Information Exchange, which is like a federal program, should be able to have that read access for medical records when we do patient transfers or any kind of working with other facilities throughout the network.
Not all hospitals,
Not all hospitals
and
are, right.
participate in that,
Yeah.
but a lot do. So that those records should be available to them. I think most clinics certainly are working to provide that information on top of that as needed. I think the one thing to make sure is that you keep your records from any off-site treatment that you get to bring back. Now, the Health Information Exchange should work both ways, but having that backup is never a bad idea.
I believe there's a fax number that patients can use to send their records, but we'll post that. It's also in an article that we're going to post shortly after the town hall. Another question, this one's from Kay from Facebook. If we have to call EMS, can we still request the emergency room at BAMC?
That will really be EMS's call. I know people do that, and I think sometimes San Antonio Fire and others do accommodate that. It's really going to depend on what you have going on and what the status of beds in the city is at that point. I think they probably try to accommodate that, but a lot of that care is going to be determined by multiple other factors, including how sick you may or may not be.
Thank you very much. Another staff question, have there been tracers to identify from start to finish how long it will take a patient to go to clinic, lab, pharmacy to get a baseline idea of how long a patient's journey will take?
Short answer, no. We don't know at this point. I think we're counting on people who have used it before. We're counting on reports from previous sites. And even those sites, it's different for every patient. We don't have an average time that it took at Tripler or San Diego or whatever it might be. I don't know if you can give any perspective on what you thought that time frame might be.
It took a little bit of time just because, again, lab had to, was doing their thing, trying to figure out their process, and the same with pharmacy. It took a little bit of time initially. I don't have an exact time, but patience. It just take patience. It just takes a little bit because everyone is trying to figure it out.
I think patients are we would just ask that they really budget the time. It may take twice as long as it usually did. It may take longer. We really don't know. Certainly, as we go into it, I'm sure we will get plenty of feedback, and we welcome that because we do want to get better. But going in, if you have what has usually been a half-hour visit, I can't tell you how much time to take off of work that day to do it. If you do have an appointment after January 22nd, and I have no doubt that will be put out there, not only by us, but it'll spread like wildfire on how long things took. But know that, it will be a continuous improvement to get back towards what you're used to.
And know that we are taking those lessons learned from previous waves and trying to implement those to reduce that time as much as humanly possible. It's just for a facility the size of BAMSI, this is the first time, level 1 trauma center with such unique specialties has gone through this transformation. So this is going to be a new one for the DoD, but we are with a team of experts that we meet every single day to talk about these very same issues and problems to try and decrease the amount of wait time and decrease the friction points. But like Colonel Osborne said, we don't know what you don't know. And so we will continue to be agile and work towards improving things.
And I can, just to piggyback on that, I can tell you just from looking at the system now and going through the meetings and even going through some of the super user courses, there have been a lot of changes that have occurred just from when I went live. A lot of processes that are better, that have made it smoother transition.
Thank you very much. So our new key word is patience. We'll make sure we keep reiterating that. And also, we're glad we're not the first ones to have to go through the transition.
And also to use those alternative things. Again, I think Express Scripts and the ability to e-prescribe, it's a huge advance, and it's easy. And so, again, the copay is something that, is to discuss at the time. But if we can do those kinds of things, we can cut your time that you spend in the hospital.
Fantastic. Thank you. Apologies to our Facebook viewers. We had a technical error with the network, but we are back online. So we are going to finish out that question.
Yeah, I just wanted to add on what Colonel Osborne was saying about providing feedback to your providers and to the outlets that are out there for Genesis. It's very important that you do that because, as the Major has said earlier, the Genesis that she works with now is a lot better than it was when she went live. And that's because of user feedback, provider feedback, clinician feedback. We're establishing a modernization committee after we go live where we're going to continue to look at our processes, continue to look at how Genesis works for the DoD, and provide that improvement feedback. So the more that you communicate with your provider, the more you communicate through the community and through our PAO, the better we can make the system and the better we can make Genesis overall moving forward here on out.
Great point, sir. Thank you. We are out of time, so if I didn't answer a specific question, we will get to it in other venues. Colonel Osborne, was there anything in closing you wanted to add just to emphasize?
Obviously, this is a huge change, and change is hard, as many people have said. But I honestly believe that when we get to the other side, things will be better. They will be more efficient. They will be safer. It's going to take time, and there's are issues that we are very fully engaged in making better going forward. So the open door remains. If we lose patients during this time, we certainly want to bring them back into the fold. Again, it will be better at the end of this.
Great point. Thank you so much. This actually concludes today's town hall. As I mentioned, if we didn't address your question, you're also encouraged to raise your question during your Genesis training, or you can reach out to the informatics committee, of which we have several members on our panel. Patients can post their questions on Facebook or send a private message or use the other avenues we discussed. Thank you to everyone who tuned in, and thank you to all of our awesome panel members for your time and great information. And we will continue to share information about MHS Genesis on all of our sites. Have a great afternoon.